Hi, my name is Shaylin Blixt, and today I will be arguing that physician-assisted suicide is immoral. Physician-assisted suicide is a major issue of medical controversy in the United States. In a recent poll taken by Gallup, 45% of people polled stated that physicians should not be allowed to partake in physician-assisted suicide, whereas 51% of people polled claimed that physicians should be allowed to partake in physician-assisted suicide, and 4% had no opinion. So as you can see, the public opinion is split fairly evenly. After taking a bioethics class and through extensive research of physician-assisted suicide, I am arguing that physician-assisted suicide is immoral and physicians should not be allowed to participate in it because they are violating several ethical principles. Physician-assisted suicide can be defined as a physician lending assistance in that he or she provides the appropriate chemical agent for patients, and then these patients administer the lethal agent to themselves. Physician-assisted suicide is legal in 4 states. The 4 states are California, Oregon, Vermont, and Washington. And it's also permissible in Montana, but only through court ruling. There are a few qualifying factors that are necessary in order to partake in physician-assisted suicide. The factors are that one must be at least 18 years old, have 6 months or less to live, and have given 2 oral requests at least 15 days apart and 1 written request. Many people believe that the major reason why one chooses physician-assisted suicide is a way to relieve pain and suffering. And though it's entirely reasonable that somebody may wish to end their life because they've had to endure more pain and suffering than anybody ever should, that's not the main reason why patients choose physician-assisted suicide. Data from an introduction to bioethics suggests that the principal reason why patients seek physician-assisted suicide is out of fear of losing autonomy, control, or dignity. It's not a fear or experience of pain. Maybe this is because patients who are allowed to participate in physician-assisted suicide must have a terminal illness and are expected to die within 6 months. They likely have already experienced more pain and suffering than anybody should ever have to. And because they've made it through this, that's not the greatest fear for them. In fact, many people see suffering as contributing to the development of character, as strengthening one's personality, and as a means of transforming the self and the community. So these patients have lived through the pain. They've allowed the suffering to develop their character. They've survived it. And pain is not the fear. It's not why they're choosing to give up. They're choosing to give up because they don't want to lose autonomy, control, and human dignity. Many supporters of physician-assisted suicide argue that a major reason why physician-assisted suicide should be allowed is out of the human right for autonomy, or freedom. They believe that one should have the right to decide when they die and how they die. I argue, however, that if physician-assisted suicide was actually an autonomous act, there would not be regulations on who is allowed to participate in physician-assisted suicide. The regulations requiring a minimum age and a number of requests are necessary in order to protect the members of our society. However, if physician-assisted suicide was truly an autonomous act, then there would not be these regulations. Anybody who wished to be killed through the means of physician-assisted suicide would be allowed to do so if the act was truly an act pertaining to freedom. Another response to the argument that by not allowing physician-assisted suicide, one is taking away autonomy would be the ethical principle of the fundamentality of rights. This ethical principle states that the more fundamental right is the one which is necessary for the possibility of the other. Where there is a conflict, we should resolve in favor of the more fundamental right. According to this principle, the natural right to life would outweigh the natural right to freedom, and thus, in arguments between life and freedom, we should resolve on the side of life, because life is necessary in order to have freedom. In addition, Dörflinger, author of Assisted Suicide, Pro-Choice, or Anti-Life, points out, and the Declaration of Independence even proclaims the inalienable human rights to be life, liberty, and the pursuit of happiness. This ordering reflected a long-standing judgment about the relative priorities. Life, a human being's very earthly existence, is the most fundamental right because it is the necessary condition for all other worldly goods, including freedom. Safeguards against the deliberate destruction of life are thus seen as necessary to protect freedom and all other human goods. In addition, Richard Dörflinger claimed, on this view, suicide is not the ultimate exercise of freedom, but its ultimate self-contradiction. A free act, by destroying life, destroys all the individual's future earthly freedom. If life is more basic than freedom, society best serves freedom by discouraging rather than assisting self-destruction. In addition to the fear of losing autonomy, patients fear losing their human dignity as well. And they fear losing their human dignity in the process of dying, and thus they seek out physician-assisted suicide. And though it is a legitimate fear, it's not really a true possibility. According to Shannon and Cochler, experts in the field of bioethics, they say, in some ways, we use the term human dignity as a way to understand the value or the worth of human life. Alternatively, we use human dignity to describe the moral status of individuals, whether someone or something is part of our moral community, and therefore worthy of protection and respect. Many people would agree that just because an individual has a terminal illness and is expected to die within the next 6 months, they're still a human being, and thus they're very worthy of protection and respect. They do have intrinsic dignity, and they will be just as worthy of our protection and respect in the process of dying as they were previously. Through a societal perspective, it's necessary to ensure that if we were to allow or require physicians to assist in patient suicide, that this would not create undue burdens on members of our society. Those who may be at risk of gaining burdens would be the elderly, the disabled, those with limited financial resources, and even those with a low self-esteem. On the surface, it does not seem like any would experience any undue burdens from allowing others the freedom to kill themselves or have themselves killed. But this initial judgment can be deceitful. The vulnerable patients may view the option of physician-assisted suicide as they may live if they want, but the rest of society does not have a strong interest in their survival, according to Dorflinger. These groups of people often view themselves as a burden to society, and they feel that it is their duty to choose death over life. This can be demonstrated through an example that occurred in Oregon in 2008. Barbara Wagner was requesting chemotherapy treatment to fight advanced lung cancer, and the Oregon Health Plan Office refused to pay $4,000 per month because it was not within the narrow guidelines of appropriate treatment. However, it did offer to pay $50 for lethal prescription drugs to end her life. Wagner told the local newspaper, "To say to someone, 'We'll pay for you to die, but not pay for you to live,' it's cruel," she said. This is a perfect demonstration of how by allowing physician-assisted suicide, it is creating undue burdens for others. And it's a direct violation of the ethical principle of limits to freedom. This principle states that one person's or group's freedoms cannot impose undue burdens upon other persons or groups. Thus, it's an unethical action to allow physician-assisted suicide because it is creating undue burdens on others, like Barbara Wagner. In addition to looking at the societal effects included in physician-assisted suicide, it's also necessary to discuss the physician's role. According to Webster's dictionary, the definition of a physician is a person skilled in the art of healing, specifically one educated, clinically experienced, and licensed to practice medicine. As stated, the physician plays a role in healing, not in killing. And as Dr. Lisa Lemon, Director for Bioethics in the Women's Hospital, Assistant Professor of Medicine at Harvard Medical School, states, prescribing a lethal medication with the explicit intent of ending a life is really at odds with the role of a physician as a healer. Not only does physician-assisted suicide deter from the physician's role, it also teeters on a fine line between so-called helping a patient and murder. How can something that is done by a physician when a patient has 6 months or less to live be okay, but if it were to be done a month or two earlier, be punishable as homicide? Physician-assisted suicide violates the sanctity of life ethos, which, as stated in An Introduction to Bioethics, claims that one must never, under any circumstances, deliberately or intentionally end life. In conclusion, physician-assisted suicide is an immoral act. It violates numerous ethical principles, including the principle of fundamentality of rights, the principle of limits to freedom, and the sanctity of life ethos. Physician-assisted suicide is immoral, and physicians should not be allowed to assist in the suicide of a patient. Thank you.